Stroke, also known as cerebrovascular accident, is a sudden condition affecting the blood vessels supplying the brain, consisting of two main types: ischemic stroke, caused by arterial blockage, and hemorrhagic stroke, caused by vessel rupture. When a stroke occurs, the blood flow to the brain is interrupted, leading to oxygen deprivation and rapid cell death, resulting in severe neurological complications. There are many factors that increase the risk of stroke. High-risk groups include older adults, people who are bedridden or have little physical activity, individuals with obesity, dyslipidemia, or blood clotting disorders. Cardiovascular diseases are also closely related, such as atherosclerosis, a history of thrombosis, atrial fibrillation, endocarditis, and diabetes. In addition, chronic conditions like cirrhosis, kidney failure, autoimmune vasculitis, and cancer significantly increase the risk of clot formation. Furthermore, people with brain-related conditions such as brain tumors, abscesses, meningitis, or cerebral artery stenosis are more prone to stroke. When these risk factors combine, the likelihood of arterial blockage or rupture rises sharply, causing sudden cerebrovascular events that threaten health and life if not treated promptly. The early signs of stroke often appear suddenly and are directly related to damage in functional regions of the brain. Patients may first experience severe headaches, nausea, or unexplained vomiting. As the damage expands or occurs in critical areas, patients may develop focal paralysis, hemiplegia, or cranial nerve palsy, causing facial asymmetry, drooping on one side, or a crooked smile. Stroke also causes various other disorders such as altered consciousness, confusion, drowsiness, coma, or sphincter dysfunction, leading to urinary retention, incontinence, or constipation. The autonomic nervous system may also be affected, causing abnormal changes in heart rate, blood pressure, and body temperature. Some patients may experience seizures or psychiatric disturbances, depending on the affected brain region and severity of vessel blockage. If the area of infarction is extensive, or if bleeding occurs on top of an existing infarction, the patient's condition can become critical with complications such as deep coma, brain edema, brain herniation, or brain death. Bedridden patients due to coma or paralysis are at high risk of secondary complications, including aspiration, pneumonia, respiratory failure, malnutrition, pressure ulcers, muscle atrophy, and joint stiffness, all of which can be life-threatening. Early detection and timely intervention are crucial for survival and recovery. Recognizing the warning signs of stroke is essential to ensure patients receive immediate medical attention. One of the earliest indicators is facial asymmetry. The patient may experience drooping on one side of the face, crooked smile, or inability to control facial muscles properly. This suggests damage to the facial motor nerves. Another warning sign is difficulty moving limbs. One side of the body may become weak or completely paralyzed, preventing the patient from lifting or maintaining the arm in position. If asked to raise both arms and one arm drops or cannot lift at all, it is a strong indication of stroke. Speech is also significantly affected. The patient may slur words, speak unclearly, or struggle to form simple sentences. In severe cases, they may be unable to speak despite being conscious. These symptoms indicate impairment of the brain regions responsible for speech and communication. When any of these symptoms appear, stroke should be suspected immediately. The most important action is to call emergency services and note the time symptoms began to help doctors choose the most effective treatment. When stroke symptoms appear, responding quickly and correctly plays a vital role in saving the patient's life. Stroke causes millions of brain cells to die every minute, making time a critical factor. At the first signs of facial drooping, limb weakness, or speech difficulty, people nearby should stay calm, assess the situation, and call emergency services immediately. Moving the patient improperly or delaying treatment can worsen the condition. While waiting for help, the patient should be kept in a safe position, with clothing loosened and breathing monitored. They should not be given food or drinks, nor should traditional methods be used to wake them, as this can cause choking or severe complications. Remembering the exact time symptoms first appeared is essential, especially for treatments like thrombolytic therapy, which is only effective during the golden window. Quick recognition, proper response, and timely emergency care can reduce brain damage, prevent disability, and improve recovery outcomes. The actions of people nearby may determine the patient's chance of survival. Recognizing stroke symptoms quickly is crucial for early detection and effective treatment. When a stroke occurs, brain functions decline rapidly, visible through abnormal changes in facial expression, limb movement, and speech. Facial drooping is one of the most typical signs. Next, limb weakness or paralysis usually affects one side of the body. If the patient cannot lift both arms or one arm falls, stroke is highly likely. Speech may also become slurred, unclear, or incoherent. And in severe cases, the patient may lose the ability to speak or understand language.